Welcome to the Healthy Hustling Podcast. I've got with me today Dr. Scott Russo. Dr. Scott Russo is a recently retired orthopedic spine surgeon, and he is the CEO of Recover Health. And now that he has retired from doing spine surgeries, he's focused more on the Recover Health side of things, where they ensure to get optimal results for patients that are undergoing surgery to make sure that they are properly prepared for surgery using visualization, mindfulness techniques, along with nutrition and supplements, and making recommendations for any lifestyle changes. So, just a really cool thing that he's doing to help make sure that those who need surgery can get optimal results. And we're going to be going over not just surgery, really, but if you're hoping to avoid surgery, this is going to be an interview you want to listen to, because with this, you can use these same techniques to really help avoid surgery, or if you're going into surgery, get the best results possible by making some of these changes. So thanks so much for hopping on here today, Dr. Russo.
It's my pleasure. Thank you for having me, Eric.
Awesome. Is there anything I missed, I guess, in that introduction that you'd want to hit on?
I mean, I think that the concept was born out of my history of being sick as a patient back in 2008, where I almost passed away or died from a staph infection, heart infection. So I really had a deeper understanding, not that I haven't over 33 and a half years of being an active spine surgeon, understanding what patients go through, but that really brought it to the forefront. And then from that point on, I started really focusing on the health of my patients and understanding where they were lacking, and had some patients that didn't do as well as I thought they should have based on the surgical procedure. In essence, they weren't physically, mentally, or nutritionally optimized for that experience. So no, I think you were spot on in that. I'm a graduate of Michigan State University as an undergrad, where I did chemistry major, Wayne State University School of Medicine in Detroit. Great experience there. Did my orthopedic training in Grand Rapids at the now Michigan State Corewell program, and then did my spine fellowship at Southern Illinois University. But really, the journey of from going into practice at 1990 through 2023 is what really shaped my approach and my understanding of what we're missing as a society in preparing patients for surgery. And it's something that patients don't think to ask their primary care doctors about, or ask their physicians or surgeons about. And a lot of surgeons aren't really aware of what we can do. And so to have the opportunity to share with you and your listeners and the people that are connected to you, I think is critical for changing the way we deliver healthcare. And so that, and maybe that's a long-winded approach, but I think there's opportunities here. And today we're going to be talking about seniors, um, and how what we do can impact how they live.
Yeah. So I guess first off, let's define that, like seniors. What age group so if you're listening to this, what age group would really benefit from this conversation?
People starting in their 20s. Now that's an honest answer, right? In today's
I
society,
agree with that.
people starting in their 20s. This is the foundation for the way people should live their life. And we'll talk about the character of the program. But if you're talking about seniors, I became a senior not too long ago, right? I turned 65, and so now I'm a senior. But
And if
I don't
you
believe, go ahead, I'm sorry.
I was just gonna say, and if you didn't like, if you haven't been doing these things, I would say it's never too late to make these changes that we're about to talk about, because you know, the body is so adaptable. So if you're still breathing and you're still moving, there you can still make these changes and still get a benefit from it. But with what you're saying, I completely agree. The earlier you implement it, the better. What you do in your 20s has a profound impact on how you function in your 40s, 50s, 60s, 70s, 80s. And research is showing that, those longitudinal studies.
We might want to even go a little bit earlier. And maybe parents who have newly born children or whatever want to listen carefully to this, because childhood obesity is rampant, and we're setting the kids up and for a future of problems.
Mhm.
And there's not going to be enough healthcare dollars to take care of all the illnesses that are self-induced. And I'm not saying that as a look, we face this. This is not a negative criticism. This is an opportunity to have an open, honest conversation to help people change the direction they want their lives to go. And what we'll talk about is it begins in the mind for the most part, and then we move from there. But in answer to your question, I'm a senior, anybody over 65, but you're right, 110% correct that it is never too late to begin, and we should always move forward. Never look back. We can't undo what we did if all we do is focus on the negative. But if we focus on putting one foot in front of the other and modifying how we do things, you can have an excellent end to a person's life.
Yeah. So let's get into, one of the big things is obviously musculoskeletal health, and especially in seniors, we're going to talk about. So why is musculoskeletal health critical as people age? Like, why is that so important? And what
So
is musculoskeletal health?
So let's talk about just an overall overarching premise in my mind. Movement is life. So when we start to stop moving, right? We start stopping moving. We're starting to lose function right from that point on. So the goal is to move. And how do we need to have great nutrition to fuel our bodies so that we move. We have the muscles, have the energy to move. And more importantly, we have to have a very powerful mind and a belief that we can get up and do stuff so that we'll do and we'll make the effort to move. So that's the overarching premise. And so musculoskeletal health, if you think about it, musculoskeletal health strengthens the mind, strengthens the heart, all the muscles. And mentally it relieves depression, anxiety, all these different things through keeping a strong musculoskeletal system. Our immune system's stronger, so we're less likely to get ill. So these are all things that having a strong musculoskeletal system is critical. And I'll give you, for instance, so the things I wanted to talk about today was, osteopenia, osteoporosis, right? There's 10 million people in our society, over 10 million with osteoporosis, over 40 million with osteopenia. It's very likely that 50% of women over the age of 50 will have a fracture related to osteopenia, osteoporosis at some time in their life. 50%. So women and people in general make their greatest bone density by age 30, and then it's going downhill from there. But there's ways to slow that down.
And so for those listening who don't know what osteopenia and osteoporosis are, so osteopenia, uh, that kind of you're going to see that before osteoporosis. It's a softening, right, of the kind of bones and cartilage and things like that. And then osteoporosis, that's we're looking at your bone mineral density. So we're looking at how dense those bones are. And if they're weak, right, they're going to be brittle. And if they're brittle, that's when you're in trouble. If you have a fall, you have some sort of issue, you're much more likely to have a fracture. And we know if you also then are more frail and weak, and you've got what we call sarcopenia, which sarcopenia is muscle mass loss, you are much more likely to have complications, whether it's with surgery, that can also be fatal. It can also lead to higher mortality rates following surgery, following falls and things like that. And so sarcopenia, um, kind of really goes hand in hand with osteoporosis a lot of times. And so it's normal that as we age, we lose a little bit of muscle mass. And I believe, is it 3 to 5% every decade? I should know this better off the
Rough.
top of my head, but I
Yeah.
want to say it's 3 to 5% every decade. And so as we age, we're going to lose muscle mass. And if you're not doing exercise and resistance training and actively moving, it's only going to accelerate that much more. So the fountain of youth is really, like you said, movement. Movement is life. The fountain of youth truly is movement, exercise, keeping your musculoskeletal health in optimal shape. So that way, as we age well, and the
The
research
answer
continues to
is
show that.
Yeah, so the answer to your sarcopenia, it's roughly after age 40, people start to lose about 1% per year of their muscle mass. So that's strength goes down, function goes down. So those things are higher risk of falling, and there's ways to prevent that. And you can be doing, and you see it in women. Roughly, I think it's somewhere around um, just a high percentage of women will have weak muscles going in,
Hmm.
very weak.
Yeah. Yeah, no, absolutely. And a part of that too is obviously when they go postmenopausal and things like that, those all play a bit of a role too with women. But what's the impact of these conditions on their overall health and quality of life? So if they, you know, if someone's like, well, my balance is good, I'm not gonna fall, but if they hear yeah, your numbers are getting close to that osteopenia or close to osteoporosis, or you're losing that muscle mass, and people try to shake it off as, uh, yeah, I'm getting old, right? Yeah, how often do you hear that? Well, I'm getting old. That's normal. I'm getting old. What would you say as far as like impacting their overall quality of life?
Well, I think it's kind of a silent disease. And so the belief is that osteosarcopenia or sarco-osteopenia, however you want to look at it, is going to be the next pandemic. So if we don't change how we live life as a society, as a world, then we're going to see so many more people, higher percentage. So more falls, more fractures. And right now, osteoporotic fractures are as expensive as heart disease, breast cancer, a lot of different ailments added together, the cost per year of treating all these fractures. Hip fractures so common. So the way to treat it is to prevent it. And that's with exercise, movement, appropriate diet, right? Protein-rich diet and we could talk about what we want, what that means. Calcium, roughly 1,200 milligrams currently per day, ideally obtained from your food, your diet. Vitamin D, typically not from your diet, so you supplement about 1,000 units per day in terms of that. But you should have your primary care doctor assess that and manage that and look at what your actual, blood levels of vitamin 25 hydroxy vitamin D are. So then you can fine tune it. But there's things that you can do that, and I think it's most important for seniors to understand that, or for children of seniors, is that you have to get up and you have to get moving, even if it's small amounts. So we could talk about what the right amount of exercise is, but small amounts each and every day throughout the day. Again, that helps you support your bones. Your bones need contact, they need movement to strengthen, to hold on to the structure that they've built over the years that you were growing.
And what would you say is a good amount of like what's appropriate exercise? You mentioned moving every day. I agree. I think that's super important. So one way you could look at that is like step count, right? A lot of people know I need to get my steps in. So that's one way to track. But how do we determine if the exercise that we're doing is appropriate?
Well, I think you have to look at and take a history from the patient. And that's why I think from a primary care standpoint, they should make a referral to an expert like yourself, physical therapist, high level trainer, and they can look at the person, look at what their general physical, because you want to know where they're beginning. If they haven't exercised
Mhm.
ever, you don't want them to go out and do high intensity exercise and have a cardiac event,
Correct.
right? You don't want that. That's bad. That's a bad day. But you might say, let's start walking to the end of the driveway and back and do that as what I call a spot drill several times during the day. And then before you know it, they're walking more regularly, and then they're walking the street. And then maybe they're going to the park, and then maybe they're holding hands with their loved ones. So they're getting that social connection too. That's the mental piece of it. So there's a lot that goes into it, and we can talk about the whole program. But I think when you're talking about physical conditioning, and do you want to talk about that now then? Would that
Sure. Yeah.
be
Yeah. Let's talk about
so
that.
in Recover Health, we have five key areas that we address from a physical conditioning standpoint. But we do is I onboard the patient. So we can talk about the whole program. Maybe that's how a patient flows through it. And then we'll get to the physical piece. So when somebody comes in, if they're having surgery, and I wanted to expand on that, we're able to take care of patients that are having surgery. That's who we built the program around. But we can take care of patients who have had surgery and they're not doing so well afterwards. So send them to us. We'll ask the patient. We can
The
put them in
optimal
the
time
program.
though is obviously they come and see you before surgery, right? And
Absolutely.
and how quickly before surgery would you recommend?
Minimum of 8 weeks before surgery. right? Or if they
Ideally in
come
a perfect world.
in,
But
ideally in a,
like they said, if you got a referral 2 week, if there's someone's having a surgery in 2 weeks or 1 week, hey, there's certain things that we can do to optimize and get best results. But ideally, they're meeting up with you 8 weeks before
yeah, you
surgery.
want them, if you're talking physically, you want to start training them 8 weeks before. If they're a smoker, you want to help them get the tobacco out of their system so they don't have as much trouble with pain and they heal better. That's what you want. If they're nutritionally depleted, you want to fill in those gaps with a healthy diet as well as appropriate supplementation. And if they're mentally anxious, depressed, right, they don't have direction, they're not focused, then we help them with, setting up a morning routine for them, an evening routine for them, how that impacts it, how our dietitian helps guide them into the Mediterranean diet. We have a nutritional kit that we created for them to start 3 weeks before surgery. That's a month worth of supplementation that fills in those nutritional gaps, right? We get them off the 3 Diet Cokes a day. We get them on to more of water or healthy juices and that stuff. So, but everything begins in reality, before we get to the physical piece, everything begins with the mind. And so when a patient comes in the program, and let's say they're dealing with obesity and they need to lose weight before surgery, right? We don't criticize people for gaining weight. That's the thing that happens to all of us over our lifetime. But there's hope that we can give the skills and the support to an individual who's challenged with weight so that they can move into the program, take control of their life, right? Take control of how they live their life, and being in control allows them to then lose weight appropriately. And we help support them with that and with their family doctor too. So when they come in, the first thing we do is we help a patient identify their why for having surgery and their why for getting healthy. If they're not a surgical patient, what's their why for getting healthy? Or we have 2 patients that have a history of cancer right now in our program who are in remission or felt to be cured. We're giving them the skill set, training their body to help give them long lasting protection, hopefully for any reoccurrence of that, right? So we're building them up when they've been beat down by the treatment. So when they come in, we help them find their why. We assess them for resiliency. We assess them for depression, anxiety, and sleep, key factors. And so we're looking to see how we impact those over time with the treatment. From a behavioral standpoint, we then talk to them about breath control techniques, mindfulness techniques, visualization techniques for health excellence. So these things that help guide behavior, help control anxiety, and put the patient in control of their life. We
Yeah,
also, go
yeah,
ahead.
I love that. I mean, I think the very first thing, like you said, with determining the why, and if you're listening to this or someone that's about to undergo surgery, they need to know, they really need to listen to this, and they should write it down on what their purpose is. Because a lot of people, when they initially come into physical therapy, it's like, well, I'm in pain. Okay, that's fine. But you've been in pain for years, so why do something about it now? Well, now it's affecting my ability to get down and do yard work or play with my kids or go running or whatever it is that they're passionate about. Okay, now we're going to dig a little bit deeper. And how, you know, how is that impacting your life? Well, it's making me more anxious, more depressed. I can't do these things that I want to be able to do and that I've always been able to do. And I can relate to this stuff because, one, I'm a physical therapist. I've always been active and an athlete. So I've always played sports and things like that. And I've had a number of, as you know, a number of surgeries myself. So for those of you listening, Dr. Scott Russo here, he did my back surgery here about 15 months ago in May of 23. And man, like that was, yeah, that the purpose and the why, it's crazy because I never thought I'd be in that spot. And so it's like my whole identity really was being attacked by the fact that like I couldn't sit without pain. I couldn't move without pain. Couldn't hardly do my job. I couldn't work out. I couldn't do anything. So my purpose was to not only like get back my former way of life, but also my wife was pregnant at the time with our first kid. I needed to be able to help her out. So my mindset too was also shifting on, hey, I got to be able to provide. So what is it? Is it your why? Is it to be able to provide for your family? Is it to be able to do sports? And drilling into that and really understanding that because it's so much more than just I'm in pain. pain is very that's the very surface level, but what is that pain
Right.
affecting you
Yep.
from doing?
And that's what we do at Recover Health. We go deep with the patient. We empower the patient. We have the time there to do what primary care doesn't have the time to do, or the surgeon doesn't have the time to do. And we have structure to the program that walks them through. We've set it up so that there's roughly 8 sessions, right? With me, with the dietitian, and with the physical therapist. And the goal is to impart these techniques and to have the patients embrace them. And they go through the surgical experience so that they recover quicker, shorter length of stay, less likely to having a complication because they're optimized in all these key areas. But if they continue these behaviors in this routine, like you have, Eric, I mean, you're working out now like you did before, and you came in as an extremely physically fit person. But the course of your treatment, as you tried to avoid surgery, you could see that you were losing that strength that you had beforehand. And
Oh
then
yeah, I mean, you pointed out, you're like, wow, you've lost a lot of muscle mass. Like my pants are baggy, my shirts are baggy. Like,
yeah,
yeah.
and you had the stress of having to run a business, have to change diapers, right? Are you going to be able to lean over and pick up your child, your newborn? All those different factors, right? Though that's tremendous amount of stress. So if you don't have the ability to control your mind, to breathe through the pain, right? To be able to see the vision going forward, like how do I run my business? Well, I can do this, right? I can control it because I know what I need to do mentally. I'll build a team around me. We'll get through this and I'll get on to the next level. Same thing with a senior who's going this, right? They may be retired and they have a hip fracture or something like that, or they are having their hip replaced so that they can walk their daughter down the aisle, right? So, and afterwards, they've been challenged with weight. So now we give them the skills to optimize their weight. They're in control of it. They work with the dietitian. They're on the anti-inflammatory Mediterranean diet, and so their life from here on out is changed and altered by the hard work that they do in preparation for a particular surgical procedure.
What do you find is like, so, and I think this is just so important, but what do you find going back to like your experience, right? Like, what's the typical route that you see people with surgery need? Do they get any of this support really from surgeons? I mean, surgeons are, and not to knock on surgeons at all, surgeons are pressed on time. The healthcare system is, I mean, just being overwhelmed because a big part of it is we're so reactive and not proactive, which is why more people are getting sick, more people are obese. We've got more inflammatory issues than ever before. So, what can people expect if they don't do this program? What can they expect from their surgeon and the follow-up and things like that?
It's this is a tough thing to measure, but the literature as it is right now shows that this process is just good for health in general. But it also shows that shorter length of stays, quicker recovery, um, nutritionally optimized, better pain management afterwards. But it takes effort and it takes hard work and it takes a team to guide them, to guide a patient to do this. But I think the outcomes in the long run are so much
And
better.
I guess what I meant by that was like, are any other surgeons really going to talk to them about a lot of these things? Are they going to dive into their sleep and some of their nutrition and what their physical activity's been, other than, if they're really obese, obviously they're going to tell them lose weight. But in my experience, what I've seen is a lot of these people are told, well, I'm not going to do the surgery till you lose weight. They're not given too much guidance after that, is what I've typically found. And
Yeah,
I'm not
you're
blaming surgeons. They only get 10 to 15 minutes a lot of times with a patient, and then they're on to the next patient.
so you're 100% correct. And I think over the course of my career, I've always wanted to use and to promote health and wellness. It's just how I live my practice. So I think with physical therapy, with your area of expertise, it's not just addressing a hip pain or something like that or back pain or whatever. I use physical therapy with a purpose, right? To change how people condition their bodies, to educate them about the musculoskeletal benefit of stronger extensor muscles if you're a spine patient, stronger core muscles, and those factors, as well as condition specific things. So the answer to your question is that most surgeons I are not doing what I'm recommending doing, and that's why we're here for them. And we've talked to them now. several surgeons in our community are seeing the benefits of us working with their patients beforehand, getting them optimized before surgery, and then having them undergo a surgical procedure, hopefully with a good clinical outcome. And the other thing is that my goal is for family practice practitioners to see that we're changing the lives of their patients downstream now. After surgery, they're continuing these healthy habits. They're continuing to keep their weight down, their body strength and tone up, and they're having just a more enjoyable life.
Yeah. What are you finding? You've hit on nutrition a little bit, but in some of the supplements like the calcium that people need and things like that. But what would you say is if there's one thing someone could focus on when it comes to nutrition prior to surgery, what would that be?
Well, I think a healthy Mediterranean diet is going to be the best thing. Eating less processed foods, avoiding, pop. And unfortunately, my dad worked for Pepsi. I mean, my baby bottle was a Pepsi bottle with a nipple. I mean, that was what we did. We grew up on. But the reality is those sugar sweetened drinks are not healthy for us. And
Hmm.
you just have to look around at how we've changed as a society with weight and that. So if people want an honest answer, there's a better way. I think the Mediterranean diet, there's many different diets, and not any one is perfect. From my perspective, the Mediterranean diet with is live, healthy foods, a little bit of red wine if you're an adult, appropriate fiber and nuts in that respect. But healthy, non-starchy vegetables, fish, heavy in fish, poultry, a little bit of red meat. That's probably the best diet. And then filling in the gaps with supplementation is certainly, I think, very reasonable based on where we are, where our food supply is these days, heavily high farmed areas of, where it's just not as nutritious. At least that's a concern.
Yeah. Yeah, I would agree. I think the biggest thing is getting off of a lot of the processed foods. I think if you can do one thing and it's cut the processed foods out, um, that can be very difficult for people. But if you can, replace your uh, pop with more water, cut down on that, cut down on a lot of it can be very confusing out there because a lot of the you know, for example, people will think that their salad is healthy, but then you look at what's in the salad and what's in the dressings and things like that, and there can be a lot of things that are causing inflammation. But trying to cut out a lot of those processed foods and stick to more, hey, if it came out of the ground or came from an animal, you're probably going to be okay. If it was made by a human, I would really check that wrapper and make sure there's
It's,
as
it's,
few ingredients as possible in there.
I think that's a
Um,
true statement. It's a challenge because we've now been growing up with this processed food, and it's easy and it's quick and it's simple. And snacking is one of the biggest issues for obesity. It's just snacky when you don't really need to eat. You're not really
yeah,
hungry,
you're
but
bored.
there's a behavior associated with it.
Absolutely. What do you see? Do you see the trend shifting in this direction for, seniors and healthcare? Where do you see kind of the future of healthcare going?
I don't know yet. I think it's an open book right now. If you look at obesity rates and overweight, if we're talking about overweight, obese, or super obese, it's almost 70% of our population. So I think that's critical to reverse because it's the inflammation associated with obesity, which is leading to potentially to arthritis, to dementia, to cancer, to heart disease, to we said the metabolic syndrome or diabetes. So these different and Alzheimer's disease. So these different factors are really strongly associated with being overweight or obese or super obese. And again, not an indictment. This is not saying and pointing a finger at anybody. It's to create awareness so that patients say, okay, I've got to modify what I'm doing. And that's where we come in at Recover Health. If their family doctors want to send somebody to us, we'll work with them to facilitate managing their obesity. We do it naturally with weight, with nutrition in that respect and healthy nutrition. And if they need to be on medications, then we'll defer to the family physician, potentially make some recommendations. But we get them moving. Ideally, seniors, if they have a Silver Sneakers program membership to one of their local health clubs, that's a beautiful time to engage in that process and to go to a class. And it may be a simple class like a dance class or maybe a bike riding class in the gym that they're part of. So those simple things. Nowadays, pickleball, a lot of different activities. Obviously, you want to be checked out by your family doctor if you've never done anything beforehand. You want to make sure that your exercise expert, your physical therapist or trainer has an appreciation of what your underlying health is. But getting and moving. And then starting to get involved, doing some yoga, some mindfulness exercises, things that we put into our program that are available to our patients to get them going, to get them thinking, how can they get healthy, right? To take ownership in their health, right? We have four simple principles, right? Personal ownership, that's number one. Personal excellence. We don't expect people to be perfect, but we expect them to give their best effort. A non-quitting spirit. And that's where we're here to support the patients and then keep it simple. It might be as simple as taking 2 5-minute walks during the day and do that for a week and then go up to 10 minutes. And you're
Mhm.
just building up and you're seeing these small wins in life that lead you to the next level of health. And then you say, I don't have to exercise, right? I was up this morning at 6 o'clock doing a workout, a mental workout, then a physical workout. I get to do that. It's my choice. I want my patients to say, I get to exercise, right? From my perspective, I've always said, I didn't care if I had a lot of extra patients, right? I get to care for them. I see myself as a healer. That's what I do. So if I can guide more patients towards a different life where they are just so engaged with their family, their friends, what they're doing every day, and they change how they think about it, they don't worry so much about what they can't do, but what they're getting to do each and every day. To me, that's energizing.
Yeah, I 100% agree with that. Um, if there's any healthcare providers that are listening, how can or people who want to connect you with their healthcare provider, how is the best way to effectively communicate, some of these benefits and stuff? How do you recommend communicating with them or
Yeah,
connecting?
so they can go to info@recoverhealth.net, not recovery, but recoverhealth.net. So info@recoverhealth.net. They can send a request. Their family doctors can go on the Recover Health website. So it's recoverhealth.net. Go on the website and they can send a referral and make a referral to us. Patients can reach out. We do take self-referrals, right? I mean,
Hmm.
we make sure that the insurance will cover them. So we do accept insurance. Sometimes with dietitians, you can't accept insurance, so there's a little bit of out-of-pocket pay there. But in that respect, it's money well spent if they are able to change how they fuel their bodies, how their family fuels their bodies, and have fun doing it. I mean, that's a wonderful thing.
So yeah, and I think that's obviously great. Getting more people on board and making sure you have a good circle where everyone is on board and understands, the intricacies and complexities because every person's a little bit different. I think is always super helpful. Um, and then so the best way then to as far as if people need to get a hold of you in general, it's that info@recoverhealth.net is what you're saying to if they need to reach out for you for any questions or anything like that.
Yep, that would be perfect. And then if their primary care doctors or surgeons want to talk and find out about the program, and we'll accept patients, they can also email me at scott@recoverhealth.net.
Okay. Yeah, great. And then any, I guess, key takeaways that you would anything further that you would say as far as musculoskeletal health for seniors, whether they've got osteopenia, sarcopenia, osteoporosis, anything like that, and any other key takeaways for these individuals?
I think that keeping in mind there's three pillars, right? You get your head in the game, right? So your mind drives your behavior, your nutrition fuels your body, and your muscles and will strengthen your bone through activity. I think that you alluded to that earlier is how important it is to move in life. And so without movement, I think it's really life threatening.
Yep.
I don't know how to say it any other way. It's life-threatening. So have fun doing it. Join classes. Get a group of people that together. Walk with your friends and your family and have a good time doing it. The exercise that you do is the best exercise. So it's something is better than nothing.
Hmm.
And
Yeah,
then you to things that are what you really are passionate about. Push it. What are your thoughts on that?
I know I love all that. I think a lot of the things that you're talking about is something I like to call habit stacking, right? And so we're stacking these little habits. We're making small changes. a really good book. I don't know if you've heard of it, but it's called Atomic Habits by James Clear.
Sure.
Really, really good book if you're looking to get rid of bad habits and make better habits. And so those little things can make such a big difference. Simply like park further away. Park at the back of the parking lot to walk to the store, to walk to whatever location that you're in. You're going to get a few more steps in. And that really is, it doesn't seem like it's going to do much and it might be an inconvenience, but it's going to really benefit you versus, so many people trying to get the closest spot possible and walk the least amount of steps to the front door. You're only making your situation worse, unless for whatever reason, obviously, if you really need that spot because you're in a ton of pain and you can't make it, then yeah, use that spot. But if you can park as far away as possible, use that time. It's only really going to take you, what, maybe an extra 30 seconds to a minute max to cover
Right.
that space, but it's going to go so much further. Taking the stairs instead of the elevator. Tell yourself you're not going to do that. When you're walking through the airport, if you're not in a huge rush and you're not in pain, don't use the moving sidewalks. Walk on the other side of those. And I'm guilty. I need to follow that because sometimes I'm like cruising along and using those to get there
I
as
think
quick.
it's kind of fun to race the people that are on the little moving escalator. So
Yep.
it's a little
Yeah.
challenge.
And then
Put your
if
clothes out beforehand, right? In the day. Set your clothes out the night before so that you're going to exercise. I'll give like for my morning routine is I'll get up, I'll hydrate, right? I'll drink a glass of water. I'll sit then and I'll think and I'll do some mindfulness, just some slow box breathing. And then I'll journal. I'll journal what I'm grateful for, who I'm grateful for, what I get to do today, right? I'll journal that. Then I'll do a little 10-minute exercise routine where I'll do, say, 10 exercises, 20 reps. Something as simple as air squats or chair squats for seniors who don't have that strength. I'll do toe raises. I'll do push-ups, sit-ups, simple things like that. That won't be the full workout, but that'll be a good warm-up for the day. So for people that are just engaging in this, they can lay in bed and do just some gentle
Mhm.
bridges, some gentle leg lifts, and then they can link their breath to the movement, right? So they
did
lift their
you read the book Miracle Morning?
I don't
A lot
remember.
of that's in Miracle Morning. They talk about I think it's script. So it's or what's the acronym? Anyway, it's journaling or scribing, it's mindfulness or meditation or prayer. It is exercise. Uh, and
And a healthy
then
breakfast, I'm sure.
yeah, so it's really like doing all of these things, and it seems like, oh, this will take forever. But even if you're slammed in the morning, if you just take 60 seconds, you start with just do it 60 seconds for each one, and then cut yourself, set a timer, cut yourself off at 60 seconds. Even if you want to go further, stop.
Yeah,
And then the next time, maybe we add another minute. So maybe it's 2 minutes. And then next thing you know, it's like you're looking forward to this. And part of that is too, is like the mindfulness stuff. I feel like if you haven't ever done it, but reflecting on what you're grateful for, like the mind is such a powerful thing. It will truly help you heal that much better if your mindset is in the right place.
that's right. I mean, it's
And it's hard
critical.
to do. It's not easy. I've
No,
been, having gone through surgeries and been in pain. Yeah, there were times where, I'm like, oh, everything's great, but on the inside, I'm just like, no, I'm miserable right now. I'm feeling fairly hopeless. But to have people like yourself, who truly care and truly want to make a difference, makes a huge, huge difference with outcomes with regards to surgery and making sure that you're going to be taken care of. You're in the best possible place to get the best results, and you have the community to support you for those days where you have questions or you're not doing as well, or or you just need a check-in.
well, think about this, and thanks for sharing your story because I mean, obviously, I couldn't share it. That's HIPAA, but the reality is that you were a prime in prime physical shape, highly motivated, mentally tough, and you eat healthy, and even you struggled. So you can
Mhm.
imagine somebody who is not in prime physical shape, who's had a lifetime of potential medical heart disease, kidneys, lung disease, whatever, and then they're coming in and having a relatively big operation. Those are the ones who really need to be prepared before surgery. They really need to have the full Recover Health program to get to where they want to go.
Yeah.
And I mean, we have had several patients this past year, right before I retired, big surgery, and they did just perfect afterwards. But they were engaged in the program. They prepared themselves, and they had an excellent clinical outcome. And that's the goal. All we want is patients to do well, and then downstream they have a great outcome. The other
Yeah.
thing we talk about is fueling after working out. So when people start to, you want, back to the amount we talked about, medium intensity exercise, you want roughly about 150 minutes per week. And that might be bike riding, walking, dancing, reasonably fast walking, moderate exercise, so 150 minutes a week. If you are able to do high intensity exercise, you can bring it down duration wise to 70 minutes a week, where you're getting your heart rate up to about 60 or so percent of your maximum heart rate. After you exercise, roughly within the first hour afterwards, you want to take at least 1.2 to 1.5 grams of protein in, per day. And as you age, seniors want a higher amount of protein per day, but you want to take in maybe 30% of that after a workout. So roughly 20 to 30 grams of protein after a workout, soon after. And that fuels your muscle, and that gives you the greatest response to muscle growth, and protects your immune system and all those different factors that require protein for healthy functioning.
Yeah. Absolutely. I couldn't agree more. We're always instructing um my patients and stuff that when they're done seeing us, hey, make sure you're grabbing some sort of uh, protein bar, chicken, uh, beef, something with protein. Um, Shake if you need, however you need to get the protein in, get it in because that's super important for your muscle recovery and to help with um, that I ideal window right there for
Muscle
protein
growth.
synthesis, muscle protein synthesis. So awesome. Is there anything else that you wanna hit on before we conclude here?
No, I think we're happy to care for patients, and obviously we're licensed in the state of Michigan. We do a lot of work via Zoom, and we coordinate care, even if they're, say, in the Detroit area or whatever, or up north. We can contribute to the conditioning, work with physical therapists in their community. I have the program outlined so they can take what I expect. And to talk about the program, physical wise, we do strength training, aerobic fitness, balance training to prevent falls, flexibility, because flexible people are healthy, happy people, and then functional activities, getting through activities of daily living, especially if they're limited with bad shoulder, how they do those things, and that's where an expert physical therapist comes in to guide those patients. So that's what we do, and we can coordinate that care with therapists all over the state of Michigan. Not an issue. Yep.
Awesome. Well, thank you so much. I really appreciate your time here today. This has
Thanks for
been
the
super,
invitation.
super helpful. I know I've learned a bit, and I always love talking about this stuff. I'm passionate about it and helping others. And so, if you are watching this again, you can reach out to Dr. Russo at info@recoverhealth.net. Check out the website. And if you know someone that's going through surgery, make sure that you share this link. So, whether you're watching it on YouTube, Spotify, Facebook, share the link with them. They can watch it on any of those platforms. So again, that's YouTube, Spotify, Apple Podcasts, and Facebook. We'll have it on all those platforms. So be sure to share it with those that are about to go through surgery.
Eric, can I say one other thing too? Was we have our nutrition kit, our surgical supplement kit that's unique, one of a kind, and that can be obtained at nutrifuelnutrition.com. It's just ordered. There's instructions for how to utilize the supplements. It's shipped right to the door. There's no shipping costs, and patients started ideally 3 weeks before surgery. You hold it for a week before surgery. Then you start up for 2 weeks afterwards. Our liquid vitamin D there's usually enough there for about 4 months of 1,000 units a day. So there's a lot of vitamin D. We usually bump it up high when they get preparing for surgery and after surgery, because vitamin D is very important for the immune system as well as for bone health. So that's easy. So that's Nutrifuel Nutrition, Nutrifuel nutrition.com.
Perfect. And I
Yeah.
will be sure to, if you're check out the description on this, this will all be in the description. So you could even simply copy and paste that into your browser and check it out. Awesome. Well,
Thank you
thanks
so much.
so Thanks so much, Dr. Russo. You have a great rest of your day. I appreciate anyone that's listening for listening in and sharing, and look forward to chatting with you some more about this in the future.
Appreciate that. Thanks, Eric.
All right, bye.
Bye now.